Good afternoon. This is the Cdbg Coronavirus Small Cities Pre-Application Webinar. We'll be starting the webinar in a few minutes. Stand by.
Good afternoon and welcome to the Community Development Block Grant Coronavirus Small Cities Pre-Application Webinar. My name is Sharita Jackson and I am the Community Program Manager for the Small Cities Cdbg program. We're so glad you've decided to join us today and we look forward to sharing valuable information regarding the pre-application process for the coronavirus funding. Today, we have an outstanding team of individuals who will join me in the webinar. We have Kate Doyle, who is the Bureau Chief for the Bureau of Small Cities and Rural Communities. We have Ted Court, who is our team leader in the Small Cities Cdbg program. We also have Jeff Amison, who is our Environmental Review Manager. And last but certainly not least, we have Kathleen Weisenberger, who is our consultant for the Cdbg Cv funding. For informational purposes, we will be recording the webinar presentation and the presentation will be available at a later date. Finally, if you have any questions during the webinar, we ask that you please enter your questions using the team's live event Q&A chat, and we will address the questions at the end of the presentation. So this afternoon, we'll be discussing the Cdbg Cv Small Cities Pre-Application Requirements and Process. Our agenda is outlined here. Today, we will be covering an overview of the Cdbg Cv Small Cities Program, Applicant Eligibility, Program Requirements, Eligible Activities, Duplication of Benefits, Citizen Participation Requirements, Procurement, Cross-Cutting Requirements, Final Application, Anticipated Scoring Methodology, Cdbg Cv, Pre-Application Submission, Questions, and after the formal presentation, We will answer questions using the Teams live event Q&A chat. So let's get started. First, we will discuss some basics of the Cdbg Cv Small Cities program. DEO receives an annual allocation of state community development block grant funds from HUD. The CARES Act appropriated additional funding to states and entitlement grantees for specific COVID-related activities. DEO's Cdbg Cv Small Cities program is designed to help grantees respond to, prepare for, or prevent the coronavirus. Activities must be critical and primarily benefit low and moderate income residents. At this time, we'll take a look at our available program funding. HUD allocated Cdbg Cv funds in three separate rounds. The state of Florida's total allocation of Cdbg Cv funds is just over $285 million. Of the $2 billion HUD allocated in round one funding, the state received $16.7 million in the state Cdbg program, and Florida entitlements received approximately $75 million. Of the $1 billion in round two funds, the state received $63.1 million to be distributed to both non-entitlement local governments and Cdbg entitlement grantees. Of the $2 billion in round three funds, HUD once again funded the state Small Cities program and the entitlement program separately. The Small Cities program received an additional $20.2 million, and the Florida entitlement communities received an additional $110.6 million. The webinar today will only be addressing round one and two funding. Here's a snapshot of our program timeline. DEO anticipates accepting pre-applications from eligible local governments in the late fall, early winter. This pre-application would identify the community need, the activity plan to be undertaken, and the tie to COVID-19. The first of two public hearings must be completed and documented in the pre-application submission. Non-entitlement applicants will be limited to a single project or activity. DEO will then conduct a capacity review of the community's pre-application for national objective and eligible activity, as well as the tie to COVID and the applicant's previous experience in Cdbg and their capacity to carry out the proposed activity. DEO will provide necessary technical assistance to applicants to ensure projects or programs being proposed are viable. During this period, the local government will hold the second of two required public hearings. After any necessary technical assistance, the local government will submit a final application, including more detailed information on the activity or activities to be carried out, including final budget, public hearing documentation, and environmental review documentation as applicable, as well as document the readiness of the project to proceed upon grant award or contract. DEO anticipates we will be accepting final applications in summer or early fall of 2021. DEO will review and approve applications and execute contracts with local governments in the fall or winter of 2021. Here we'll find additional information regarding our program timeline. As you can see here, on December 18th, we published our notice of funding availability. From the period of February 1st through March 15th, will be our pre-application cycle. And at 5 p.m. on March 15th, that is the deadline for submission for pre-applications. Our final application cycle will be anticipated in the spring or summer of 2021. Please note that some of these dates may change depending upon the number of applications we actually receive. Applicant eligibility. So how do you know if your jurisdiction is eligible for funding? Who's eligible to apply? Counties with less than 200,000 residents and cities with less than 50,000 people who have not accepted special entitlement status with HUD and/or who have not opted to join an urban county entitlement program are eligible. You can find the list of eligible communities on the DEO Cdbg Coronavirus Relief webpage. And here's a snapshot of what that webpage will look like. And if you look at the bottom of the slide, you'll see the website of www.floridajobs.org Cdbg-Cv. Now let's talk a little about the Cdbg Cv funds and the required relationship to COVID-19. Per the CARES Act and subsequent Federal Register notice, all Cdbg Cv funds must be used for activities that respond to, prepare for, or prevent the coronavirus. These can be costs that are directly related to the virus, such as rehabbing for social distancing, vaccine distribution or testing. This could also be used for things that are indirect impacts from COVID. This would be activities like rental assistance to people who have lost income due to the shutdown, or companies that were impacted financially due to the shutdowns or social distancing, or even added expenses of cleaning and PPE, which is personal protective equipment. DEO will be reviewing all applications to ensure the activities proposed can be tied to the impacts of COVID-19. Here we've included some examples of projects that have a relationship to COVID, and we've also included some that don't. The first one we have is to rehabilitate a building or facility for testing, diagnosis, or treatment. So we see here that this is one that one of the ones that is eligible for proves or provides a relationship to COVID-19. We have the reconstruction of sidewalks or expansion to allow for social distancing. We have the construction of a new community center or playground in an LMI community. This is not a good example of a relationship to COVID-19. The next one we have is installation of wiring, fiber optic cables, and permanently affixed equipment, such as receivers for LMI areas to receive broadband or internet access. This is a probable good tie to COVID. Owner-occupied single-family rehabilitation. As we see here, this is not a great example. We have to acquire and rehabilitate or construct a group living facility that may be used to centralize patients undergoing treatment. And we also have rehabilitation of a senior center by replacing the HVAC system and/or installing air purification system. In regards to the community center, it's important to note here, we're talking about a general community center for the use by the residents of a community. Rehabbing a community center for social distancing or turning a portion into a testing site could be eligible. If you're not certain if the project will be considered COVID related, it's important that you contact us at DEO. Cdbg Cv National Objectives. All activities funded with Cdbg funds must meet a national objective of the Cdbg program. The primary national objectives of the Cdbg program are to benefit low to moderate income, which can be achieved in 4 ways: through area benefit, limited clientele, housing, jobs. Low to moderate income is a person who is part of a family whole total annual income based on family size is at or below 80% of the median household income for the county or the metropolitan statistical area. The next national objective is the prevention or elimination of slum or blight, which can be achieved in one of two ways: through area basis or spot basis. The final national objective is meeting an urgent need which poses a serious and immediate threat to the health or welfare of the community. The Cdbg Cv program requires that DEO spend a minimum of 70% of funds allocated on the first national objective. In addition to meeting a national objective of the Cdbg program, Cdbg Cv projects and programs must also be designed to prevent, prepare for, or respond to the coronavirus pandemic. Therefore, DEO thinks it is unlikely that a fundable project will be using the national objective of slum or blight or LMI housing. If you believe you have a project that meets the criteria for Cdbg CV and intend to utilize one of these national objectives, please reach out to DEO immediately to ensure fundability of your project. For activities to be determined to be an indirect benefit, like infrastructure, public facilities, or jobs, at least 51% of the persons benefiting must be LMI. For activities determined to be a direct benefit, like housing rehabilitation, 100% of persons served must be LMI. We're going to talk a little more now about what kinds of activities are actually eligible. Here we have a list of proposed eligible and ineligible activities under the all eligible activities of the Cdbg program available under Section 105 of the Housing and Community Development Act are available for use in the Cdbg Cv program. However, all activities must be able to show how they are designed to prevent, prepare for, or respond to the coronavirus. Basic categories of eligible activities are, as listed on the slide: acquisition, public improvement, public facilities, business assistance, micro enterprise assistance, public services, planning, broadband planning, and in public infrastructure. Ineligible activities include general government expenses, anything regarding buildings for the general conduct of government, political activities, purchase of equipment, operating and maintenance expenses, new housing, and income payments. Please note that DEO will be reviewing all proposed activities to ensure there is a tie to COVID-19. As mentioned before, non-entitlements will be limited to a single project. For example, a community wants to expand homeless shelters capacity within their jurisdiction due to increased need at the current shelter due to coronavirus pandemic. The project might include the acquisition of a building and the rehabilitation of that facility for use as a homeless shelter, but this would be considered a single project. Over the next few slides, we'll take a look at sample activities that a community may undertake. So here we have building and improvements, including public facilities. So the first category we have is acquisition, construction, reconstruction, or installation of public works, facilities, and site or other improvements. So a few of the suggested or sample activities are reconstruction of roads and sidewalks to allow social distancing, considering installation of wiring or fiber optic cables for LMI areas to receive broadband or internet access. We know that was a big one for many children who were at home or parents who were working at home. Additionally, we have rehabilitation of buildings and improvements. We have rehabilitating a senior center by replacing the HVAC system and installing an air purification system, acquisition and or rehab of a building to expand the capacity for homeless shelters to accommodate social distancing and isolation, as well as the installation of Wi-Fi routers or extenders in an affordable housing building for LMI residents. Here we're talking about assistance to businesses, and it includes special economic development assistance, which talks about provisions for profit entities or private entities to carry out economic development projects. And we also talking about provisions of assistance to micro enterprises, which includes grants to support businesses to create jobs, as well as to allow them to manufacture medical supplies to respond to the infectious disease or retain jobs that have been impacted by COVID. Additionally, is technical assistance for grants and other financial assistance to establish and stabilize and expand micro enterprises and other services to support home health quarantine. Next, we're talking about public service sample activities. And these activities deal with making provisions of assistance for primary low and moderate income persons. So suggestions are such as job training to expand the pool of healthcare workers and technicians that are available to treat disease within a community, to provide testing, diagnosis, and other services at fixed or mobile locations, to provide equipment, supplies, and materials to carry out public service. Also to deliver meals on wheels or to quarantine individuals that need to maintain social distancing due to medical vulnerabilities. Our last slide, we're talking with sample activities, we're talking about planning. So we have planning only grants that deal with gathering data and developing non-project specific emergency infectious disease response plans, as well as project planning, which has to do with planning activities in conjunction with another eligible activity. So these are just some sample activities of projects that can be undertaken. Now we're going to talk a little bit about duplication of benefits. The CARES Act requires us to ensure that adequate procedures are in place to prevent any duplication of benefits as required by the Robert T. Stafford Disaster Relief and Emergency Assistance Act. A duplication of benefits occurs when a person, household, business, government, or other local entity receives financial assistance from multiple sources for the same purpose, and the total assistance received for that purpose is more than the total need for assistance. Cdbg Cv funds cannot be used to cover costs that have already been paid for or that will be paid for by another federal program, insurance, or other sources. If this occurs, the grantee will have to repay that amount to its Cdbg Cv account. Before Cdbg Cv assistance is provided, a grantee must verify that subrecipients, assisted individuals or families, businesses, and other entities have not previously received or will not receive duplicative assistance from another source. For example, requiring entities or beneficiaries to provide a self-certification indicating they have not received a duplicative benefit, or requiring entities or beneficiaries to fill out a questionnaire listing potentially duplicative assistance that they have already received or reasonably anticipate receiving. HUD has provided a list of federal sources that might result in a duplication of benefit. You can link to this document from the program guidelines or find it listed above. These are not the only possible sources of duplication, so please be sure to fully vet your projects using the Duplication of Benefits worksheet provided by DEO. Applicants must include a copy of their duplication of benefit policies and procedures with the pre-application or final application to DEO. DEO will be recapturing all funds that are determined to be a duplication. Here you will find a copy of the Duplication of Benefits worksheet. To alleviate issues, applicants must develop and maintain adequate procedures to prevent a duplication of benefits. Procedures must include a method to assess whether Cdbg Cv funds will duplicate financial assistance that is already received or likely to be received by acting reasonably. A copy of the Duplication of Benefits procedure must accompany the Cdbg Cv application. Persons or entities receiving Cdbg Cv funds must repay duplicative assistance. Now we're going to talk about citizen participation requirements. It is important to note that this is a program of the state Cdbg program. Therefore, all citizen participation requirements are those in 24 CFR Part 570, and policies for implementation are set by DEO. For the Cdbg Cv, all regular Cdbg applicable citizen participation plans requirements must be followed. They should provide for and encourage citizen participation, particularly by low and moderate income persons who reside in areas in which Cdbg funds are proposed to be used. They should ensure that citizens will be given reasonable and timely access to local meetings, information, and records relating to the unit of local government's proposed and actual use of Cdbg funds. And they should provide an opportunity to obtain residents' views on COVID-related housing and community development needs. They should also furnish citizens information, including but not limited to the amount of Cdbg funds expected to be made available by the program, the range of activities that may be undertaken with the Cdbg Cv funds, the estimated amount of Cdbg Cv funds proposed to be used for the activities that will meet the national objective or benefit low and moderate income persons, and the proposed Cdbg activities likely to result in displacement and the unit of general local government's anti-displacement and relocation plans as required under 24 CFR 570.488. All public notices must be advertised in a newspaper of general circulation and must be a minimum of 5 days prior to the hearing. It is suggested that other means of communicating with the public are also used, such as Facebook, Twitter, and the applicant's webpage. Please ensure that your notices give enough information about the activities you're proposing to allow citizens the opportunity to understand if they are affected and respond. Time and place. The time and place of a public hearing are important to meeting the requirements for Cdbg Cv. Here we have, if the public hearing for a project near Lanark Village is held in Apalachicola on bingo night in Lanark Village, could a citizen argue that the hearing was held at a time and place to discourage Lanark residents from participating? Well, here we'll find that the answer is actually yes. It could be argued that a hearing in Apalachicola on bingo night in Lanark Village intentionally or unintentionally discourage residents from Lanark Village from participating in the public hearing. So we have to be very careful of time and place. Now we're going to talk a little bit about virtual public hearings. So virtual public hearings are certainly acceptable. However, we recommend considering the following. The meeting must allow all participants to ask questions in real time and allow a period for the questions to be basically asked and answered. It is best to use virtual platforms that allow the option for conference calls. And we've listed a few of Google Hangouts, Zoom, Facebook Live, or other virtual platforms. You should consider call-in options that don't require internet connection. As we know, some of our local governments tend to struggle with internet connections, as well as you should consult with your attorney prior to implementing virtual public hearings to ensure they meet your local requirements. The first public hearing, which must be completed prior to submission of the pre-application, is to provide the residents information on the available funding, discuss the types of activities that could be implemented, and to get resident input on the community's needs regarding preparing to, responding, and preventing the coronavirus. The second public hearing is to provide information on application, project activities, and collect comments on the project. As mentioned previously, you must conduct the first public hearing prior to your submission of your pre-application, and documentation will be required to be uploaded in the Qualtrics system. Here we're going to talk a little bit about procurement. Cdbg Cv funds are subject to procurement under 2 CFR 200 as well. Here we're listing some of the procurement requirements. All normal Cdbg procurement regulations are in place is what we have to ensure. We have 2 CFR 200, the 24 CFR, Florida Statute 287.055 for architects and engineers, and the local government's procurement policies if they are stricter than the state or federal requirements. More information regarding procurement requirements can be found on the DEO website under downloads for recipients, and then you can search procurement and labor standards. Procurement of professional services. Grantees should use Form SC64, which is the checklist for procuring professional services, as well as SC61, cost summary negotiated contracts for all professional services contract. Our next slide here discusses the Consultants Competitive Negotiation Act. It's regarding Florida Statute Section 287.055. It deals with engineers and architects, and it has no price information before negotiations, cannot reconsider a firm after ending final negotiations, and you must conduct a detailed cost analysis. All procurements in excess of the federal simplified acquisition threshold, which is currently $250,000, must have an independent cost estimate prior to receiving bids or proposals. On this slide, we'll talk a little bit about cost price analysis, which deals with procurement type, methodology, contract type, a solicitation method, goods and services. An independent cost estimate serves as a yardstick for evaluating the reasonableness of the contractor's proposed costs or prices. An independent cost analysis consists of evaluating the separate elements, for example, labor, materials, etc., that make up a contractor's total cost proposal to determine whether or not they are allowable, directly related to the requirement, and reasonable. Price analysis is essentially price comparison. It is the evaluation of a proposed price, total or sum, without analyzing any of the separate cost elements. Whereas cost analysis is the evaluation of the separate elements, labor, materials, profit, etc., that make up the contractor's total cost proposal or price to determine if they're allowable, directly related to the requirements, and ultimately reasonable. Cost analysis should apply to both new contracts and contract modifications or change orders. This slide, as I stated previously, gives examples for each procurement method, the price or cost analysis, contract type, solicitation method, and examples. Cross-cutting requirements. The CARES Act does not waiver Cdbg requirements for environmental review, labor standards, URA, civil rights, fair housing. All Cdbg Cv projects or programs must still meet the requirements for environmental review. Uniform acquisition and relocation, federal labor standards, financial management, including program income, and procurement and all civil rights and equal opportunity law, including the requirement that the local unit of government affirmatively further fair housing. The CARES Act does not waive Cdbg requirements for an environmental review. All Cdbg Cv projects or program must still meet the requirements for environmental review that are outlined in 24 CFR Part 51, 24 CFR Part 58, and the state Cdbg regulations at 24 CFR 570.604. The first requirement to understand for the environmental review process is the importance of avoiding choice-limiting actions. The local government grantee and all participants in a Cdbg project, including other public entities, nonprofit agencies, or for-profit developers, or any of their contractors, cannot commit HUD or non-HUD funds if an activity would have an adverse environmental impact or limit the choice of reasonable alternatives. If we are aware that a subrecipient, developer, or beneficiary is about to take action that would limit alternatives or choice limiting actions, we must take appropriate action to defer those actions to ensure that NEPA and related laws are reviewed and followed before choice limiting decisions are made. Examples of choice limiting actions include acquisition, leasing, rehabilitation or construction, and site improvement, which includes demolition and site clearance. These are additional examples of choice limiting actions. We talked about demolition, acquisition of land and structures, construction bidding, new construction, rehabilitation, leasing, and site improvements. Since everyone may not be familiar with the environmental review information, we will be going over the basics today. There are 4 levels of environmental review: exempt, categorically excluded, environmental assessment, and EIS. Categorically excluded has 2 subgroups: subject to and not subject to. Starting now with the lowest of the review, which would be the exempt activities. Typically, exempt activities include administration of CDBG projects, environmental assessment or studies, planning or management, engineering, or architectural design and inspection. Exempt activities are defined as Section 58.34 of the HUD regulations. Even exempt activities require environmental review and documentation before proceeding. We will cover the review process after discussing all of the categories of review. Some examples of exempt activities are general CDBG administration, planning only activities, design costs, and public service activities. So here it's listing a few for us. Under categorically excluded, there are 2 classes of activities. These are named excluded because they are excluded from certain NEPA requirements, but not all federal laws and environmental requirements. These 2 categories are often shortened to exclude not subject to, or excluded subject to, or just subject to and not subject to, and even just their acronyms, CENST and CEST. Some example of CNST activities are tenant-based rental assistance, supportive services, operating costs including utilities and supplies, economic development costs not associated with construction or expansion, home buyer assistance, affordable housing pre-development costs, and maintenance. Activities, keep in mind that not all activities listed in 24 CFR Part 58 are eligible for CDBG, and particularly Cdbg Cv. Activities must still be eligible in the Cdbg program and be related to Coveted for Cdbg Cv funds. Categorically excluded, subject to. Examples of activities in this category are acquisition, when there is no change in land use, removal of architectural barriers, and rehab of buildings. If an activity is not listed in Part 58 under one of the categories of review, the level of review for your project would be environmental assessment. Finally, environmental impact statements, the highest level of review, are required when a project is determined to have a potentially significant impact on the environment. It is important to note that the size of the project alone does not determine significance. The nature of the impact does. The environmental impact analysis is not limited to the potential impact of the HUD-assisted activity. It examines the site and surrounding area and must consider the potential impact from the entire scope of the area potentially affected by the project's activity. You very rarely see environmental impact statements for CDBG projects. Environmental impact statements are required for projects such as a new airport, dams, or train stations. These projects are seldom funded with state CDBG funds. Most rural areas and small towns do not undertake projects of this magnitude. Applicants proposing categorically excluded subject to or environmental assessment projects or activities should submit the certificate of exemption or the categorically excluded form along with compliance documentation with the pre-application. If you are uncertain about the level of review required for your proposed activity, please contact DEO for additional technical assistance. Applicants are reminded that the maps are to be in color and indicate the project location or facility where the exempt or the categorically excluded, not subject to activity will occur. You should also indicate the amount of funding for each exempt or categorically exclusive, not subject to activity is indicated. Categorically excluded and environmental assessment projects will be required to submit forms and compliance documentation with or before the final application submission. Applicants proposing categorically excluded subject to or environmental assessment projects should submit the certificate of exemption or the categorically excluded form along with compliance documentation with the pre-application. If you're uncertain about the level of review required, please contact DEO for technical assistance. Cdbg Cv is subject to all requirements of the Uniform Relocation Act and Real Property Acquisition Act, as well as Section 104D of the Housing and Community Development Act. More information on DEO's URA policies, procedures, and forms can be found on the DEO downloads page for recipients. The CARES Act does not waive other cross-cutting Cdbg requirements for labor standards, URA fair housing. All Cdbg Cv projects or programs must still meet the requirements for environmental review, uniform acquisition and relocation, federal labor standards, financial management, including program, income, and procurement, and all civil rights and equal opportunity law, including the requirement that the local unit of government affirmatively furthers fair housing. Cdbg Cv is subject to all normal Cdbg requirements for financial management and procurement according to 2 CFR 200 and DEO policy. More information on DEO's financial management policies and forms can be found on the DEO Downloads for Recipients webpage. Cdbg Cv is subject to all normal Cdbg requirements for labor standards and Section 3. More information on DEO's financial management policies can be found on the DEO download website for recipients. Cdbg Cv is also subject to all Cdbg civil rights and fair housing requirements as well. So now that we've gone through all the basic rules and requirements, let's talk about how we submit the pre-application. This slide outlines the scoring categories that we anticipate using to rate and rank final applications. Rating and ranking will not occur during the pre-application phase, but we want to provide you with these categories so that you will know how you will be scored when planning for your projects. These will also be used when we're providing you with technical assistance following pre-application submission. The first category will be Readiness to Proceed. Points in this category will be awarded on the basis of documentation and information provided, showing that the resources needed to manage the proposed activity are available and ready. and that the commitment for operation and maintenance, where applicable, has been certified. Maximum points will be given to activities that are ready to move forward quickly. Typically, this means that the design and engineering work, if applicable, is underway or has been completed. Points will be awarded to projects that will have an impact on low to moderate income persons in communities. Projects that will be serving presumed LMI beneficiaries, such as seniors or homeless, will receive higher points. Points will also be awarded based on a DEO formula based on unemployment data from communities with the greatest economic need and impact related to COVID-19. The experience of the applicant, including the length of time in business and experience in undertaking programs or projects of similar complexity as the one for which funds are being requested, will also be evaluated. In addition, the capability and skills of administrative and program staff to carry out the program. The project will be evaluated based on need and how well the project outcomes address the needs identified. Finally, the project will be evaluated in terms of cost reasonableness and feasibility. Pre-application submission. So now that we've gone over the rules, we'll continue to talk about submitting the application. The first step in preparing your pre-application will be to identify the community's needs. This will be done by conducting research, evaluating current programs, and particularly by conducting the first required public hearing. The hearing must be conducted prior to submission of the pre-application and be properly noticed and include grantees for factor analysis and the language access plan if applicable. More information on this requirement can be found in the program guidelines on the Cdbg Cv webpage. The next step will be to identify any subrecipients. If subrecipients will be used in the Cdbg Cv entitlement program documentation of the relationship, and commitment should be obtained for submission with the pre-application. These partnerships may or may not be identified at this stage. Please include as much information about partnerships as possible in the pre-application to expedite the DEO capacity review. You will also need to identify the key personnel for the project and grant administration. Will you use your staff or will you need to procure services? Documentation of prior experience will be uploaded with the pre-application. Based on the national objective for your project, you may be required to determine if census data supports your service area or if an income survey will be required. You will need to determine if your beneficiaries are a presumed group or already have documentation of 51% LMI based on other programs, or will intake documents be necessary? You will also need to develop your project budget. Final detailed project budgets do not have to be finalized by the pre-application, but should be as detailed as possible and include all funds that will be requested. All pre-application must be submitted online. The link to register for a pre-application will be on the Cdbg Cv website on February 1st. A personal one-time link will be sent via email within 2 days of submitting registration. Okay, we're going to go through the steps to submit a pre-application. First you will be required to register to get the pre-application link. So here you see the applicant name. After you've already registered to get your pre-application link, we'll have your applicant's name, who's preparing the application, email address, phone number, the local government contact, their name and email address. Once you receive the single-use pre-application link, you can log into the Qualtrics system and enter your application. Throughout the pre-application, tips are provided. So quick tips are always provided, a little light bulb at the bottom of the pre-application. The online application will automatically save as you go. Until you submit the application, you can return using the same link. However, pages that have been completed cannot be returned to. DEO recommends completing your application in a Word document and preparing all uploads before you begin entering the application into the system. Once you have submitted your application, you cannot return to the application. If you have any questions or issues, you can always contact DEO using the information in that last bullet, 717-8405, or cdbg-cv@deo.myflorida.com. Okay, so the following documents will be required as a part of the pre-application submission. So the federal identification number, your sam.gov with expiration date, the cage code information, which is also found on sam.gov, your DUNS number, regarding public hearing, your 4-factor analysis, if applicable, your language access plan, public hearing notice, and please make sure they're large enough, the print is large enough for us to review, the publisher's affidavit confirming the public hearing notice, meeting minutes, and they must be certified, as well as a sign-in attendance sheet. You also want to include the recipient information, such as letters of commitment, application documents, federal ID number and your DUNS number, proposed budget template, as well as key personnel, staff who will be working with you on the project. You want to include their resumes and jobs descriptions, as well as grant consultant, request for proposal documentation if it's applicable, including the scope of services to be provided, as well as a public notice. At this point, we'll answer any questions that may have been included in the chat. Kate or Pam, do we have any questions already in the chat?
Yes, and I will be asking some of those questions and calling on some folks to do it. Thank you, Sharita, so much for your presentation. And to everyone, as a reminder, we are going to be following this up. We will be sending out the webinar slides after the fact. And once we have an opportunity to transcribe this session, we will be able to post it on our website as well. And want to also direct everyone to www.floridajobs.org/CDBG-CV, and that's where we have a lot of the materials that go over how we do this. You'll see that the pre-application registration is not yet live. That will be available on February 1st when we will be opening the pre-application cycle at that time. So at this time, I'm going to start going through some of the questions, and then I'll be asking some of the participants, some of our presenters on the call to assist with our answers to those questions. So let me start with the first question that we have here. Will funding be available to cover, and I'm going to call on Ted Court for this answer, and I'm talking about the funding for environmental review. So Ted, I've got you unmuted. Will funding be available to cover expenses associated with conducting the environmental review?
My response to that is if a local community receives an award under the grant, then they will be able to request reimbursement for costs incurred to undertake the environmental review. They would submit a written request to the department, and then DO would issue a letter of acceptance. The costs that are incurred have to be incurred in compliance with program requirements. If you're an existing or past small city Cdbg recipient of funding, then you should have a Cdbg procurement policy that dictates how you handle the procurement of professional services or otherwise. Additional costs which would certainly be reimbursed upon, submitting a written request would be like the cost of advertisement and such. But the answer basically is yes. If you receive an award, then costs that you incurred to undertake the environmental review would become allowable.
Right. And that's only if they actually do receive an award. So they would be undertaking those activities to an extent at their own risk, hoping that they would be receiving an award from DEO. Is that correct, Ted?
That is correct.
Okay. The next question we have is, will you send these slides to us after this meeting? Yes, we are going to also provide those on our website, which is www.floridajobs.org/cdbg-cv. And if you are on our email distribution list, if you received the email about this webinar, you will also be getting the slides after the presentation in the next week or so. And additionally, if you are not on our distribution list and you're not receiving the emails such as events about the webinars, please do email us at cdbg-cv@deo.myflorida.com. The next question I'm going to ask is about the construction. It was with the construction of a workforce development center to help LMI folks who lost jobs to COVID be eligible. Kathleen, I want to maybe unmute you, and I think, hold on just a moment. Let me try to get you unmuted for this one. Okay, I'm sorry, I'm having trouble getting Kathleen unmuted. So Ted, I'm going to be asking you, with the construction of a workforce development center to help LMI folks who lost jobs due to COVID be eligible?
I'm uncertain as to that question. I know that, HUD is allowing you to do activities, which generally help people regain employment. But I would find it, basically the job services office is an office for the general conduct of local government, providing them the employment services. I'm not sure that would qualify. My first response was no, which is why I was pleased to hear, Kathleen, if Kathleen could speak, provide a response to that. What I would ask them to do is let us go ahead and give consideration to that question. We're going to have a discussion when we're done here. We'll certainly include a consistent response with the Q&A when it's printed.
Okay. I do think that, hold on just a moment. Okay, so I'm reading through, and Kathleen, I apologize, I'm not able to get her unmuted, but she does answer that there is a potential for that to potentially be eligible, but we need to understand how you would meet a national objective. That you would essentially have to guarantee that income verification documents 51% LMI beneficiaries. So the questions that we might ask you are things like, what area would the facility cover? is it a government-run center, things like that. So we can provide you with technical assistance on that individually. We do have our email address, which is cdbg-cv@deo.myflorida.com, and also 850-717-8405 is another place where you can contact us to ask these types of technical assistance questions after the fact. So the next question that we have is, does COVID-related rehab to a drug rehab center, jail, and/or food bank meet the LMI national objective, since it is assumed the clientele are LMI? For example, in this case of a food bank, yes, that would be limited clientele under nature and location. A drug rehab consider, the answer that would be no. That there's no waiver for this under Cdbg Cv funds. You would have to document the limited clientele with intake documents or other sources. And then a question that would be asked is, are they all Medicaid patients? Okay. What HUD codes should be used for a broadband project? I might need to ask for a little more clarification on that.
I might have a response to that.
Okay.
It would probably be utilities other, and they wouldn't have to worry about the code, because what they're talking about is constructing utilities, I believe, in their question, but we can look into that and discuss it amongst ourselves, because they could be building the infrastructure for the, to bring in the services as such, but there may be some direct benefit activities also if they're putting equipment in people's homes.
Okay.
Was that clear?
Yes, thank you. For micro enterprise grants, do the businesses have to relate to COVID?
I would think, and again,
yes.
This is just me. Go ahead.
Yeah, going ahead. A grant can be made to a business as long as the project is meeting a national objective, such as job creation or retention for 51% of low to moderate income persons.
There you go.
Would a training center to retrain those LMI unemployed into other fields be an eligible activity?
Are you again relying upon me for a response to that?
Yes, sir. Mm-hmm.
Okay, because I drafted one. I was doubtful that it would be. I mean, what existing facilities do they have? How is the facility going to be used after the fact? That's kind of an unknown that we will have to discuss and develop a formal response to. Okay. Yeah, basically, you're talking about building a structure. Don't work in the employment services, but they have the local workforce boards. Are those like quasi-governmental entities, or are they under contract to provide these services to the state? Right. I don't have enough of a background in that area to really provide you with a confident answer. Right.
Right. And I think that we're getting information from Kathleen that she said that generally, like if they had training and things like that, that would be eligible. Cool. Hold on just a moment. I'm going to try to see if I can unmute one more time. Hold on just a moment. And Pam, if you can hear me now, the 317 number area code, if you could try to unmute that on your side, that would be helpful. Okay, so does DEO have a duplication of benefit procedures template that you can share with us? I do think that we have in our program guidelines some information about the duplication of benefits. and as well as the information that we've provided during the slideshow. I think that you may end up needing to come up with some procedures for that, but we can see what kind of materials we can provide, and we will put that up on our website. Would replacing plumbing to install touchless water faucets and update a public park restroom? Ted, do you want to take this one? It seems like in some ways I would be curious what the COVID, the tie to COVID would be, but could you also talk to us about that? Would replacing plumbing?
If the project qualified under, a national objective such as the LMI, I don't see why you couldn't replace plumbing to have touch-free toilets and touch-free water faucets and such. That would, you have these facilities that are currently unavailable to the public, or at least their use of those facilities would be, would be putting themselves in threat of contracting COVID. So I would think that would most certainly be an allowable activity.
Correct. Okay. There was a question about whether the duplication of benefits procedures for a community must be submitted with the final application and not with the pre-application. I think that in our pre-application, there may be some questions about the duplication of benefits procedures, just asking to make sure that you will confirm that you have a duplication of benefits procedure in place. If you do have those procedures already at the time of pre-application and you can submit those, then we will review those and provide you with technical assistance if there's any changes that need to be made. But the final duplication of benefits procedures will be required at the final application phase, not the pre-application.
And just to add something like that, they're talking primarily with direct benefit projects where you're providing a direct benefit to a recipient. Otherwise, your duplication of benefit would be, I think, probably in the application and in our monitoring processes, that if you're getting money from more than one source that's going into the same project, that type of duplication doesn't apply. But when it comes to direct benefits, the documentation is more complicated. You have to show that you've in some way, contacted various sources that may or may not apply to make sure that they didn't receive benefits, and then the recipient of the direct benefits is certifying that they're applying for this and that they haven't received benefits from another source previously for the same assistance that they're requesting. And if in the future they do receive benefit from another source for the same assistance they're providing here, that they assign those benefits to the unit local of government in the state of Florida and HUD. So I'll just leave that at that.
Okay. Is there a list of projects which qualify under the urgent objective?
Virtually any project that you want to do can qualify. Any Cdbg project can qualify under the urgent need national objective. The urgent need national objective does not require you to serve 51% LMI, but you have to demonstrate that the project that you're undertaking is necessary directly as a result of the COVID pandemic. It has to be discussed, legislatively, and it has to be recognized by the local government as presenting a threat. In that legislative process, which would be, like your documentation in your minutes, discussing why it's tied to it, the threat that it presents, confirming that the local government, the applicant/recipient, has no other available source of funding to to cover those costs as such, and then a resolution to submit the application to the state of Florida. We would have to review it and confirm that you undertook those steps, and before we could make a determination. When it comes to the national need, urgent need national objective, we're limited in the amount of funds that we can. I think it's like it would be less than 30% of our funds overall could go to those types of activities, and we can provide a sample urgent need national objective worksheet, which kind of gives you an example of how you would justify something like that, but we don't have them here for this. Okay.
Well, thank you, Ted. Yeah, I think we don't have a specific list of the of projects for the urgent objective, but similar to what Ted had said, just to meet that national objective, you have to make sure that the project is addressing a problem that is of recent origin, 2, that it's a threat to the health and safety of the public, and 3, that no other funds are available, including loans, for the project. And because of that restriction that Ted said, that no more than 30% of our funds can be used for non-LMI activities, that when you're in the competitive rating and ranking, those projects that meet the LMI national objective are going to be ranked higher than a project that meets the urgent need category and doesn't also meet LMI as their national objective. So that doesn't mean that we wouldn't fund urgent need projects. You're just not going to get as many points in the competitive application cycle for one that meets the urgent need national objective. Okay, so we had the question again about for grants to new or expanding businesses, do the jobs have to be for COVID supplies, etc.? And I do not think that that's the case, that they have to be for COVID supplies. We did have that as an example, and obviously that would be a really clear tie to the COVID need. But I think that if you were able to show COVID impact through an economic impact or something like that, you still could provide grants to new or expanding businesses. Is that correct, Ted?
That is essentially correct, yes.
Okay. It says for business grants, what can be funded? For example, if a business will be doing something like providing takeout food to the public, would there be eligible costs?
I would have to look on that, specifically. I have to consult with Kathleen to clarify that. What constitutes a grant? What are the allowable expenses? Allowable applications, or the allowable costs that you can use that grant to pay for. We'll have to discuss that with Kathleen and get that out.
Will rent, mortgage, and utility assistance be eligible for LMI persons, and what level of income verification would be required?
I would presume it would be the same type of documentation that you would have for like a housing grant or something. It'd be like a direct benefit. They would have to show what their income is, if their Social Security, if their retirement, and if they're currently unemployed, then maybe a copy of their unemployment statement showing what their level of income is and what their basic assets are. I don't think it goes, if you have money like in an IRA or something like that, and you're only pulling it out slowly, I don't think that the bulk of the IRA applies. But, if you're receiving a monthly payment from that, then that would be considered income. So it would be the standard income that you use for a housing grant for determining eligibility.
Okay. Can a project have a secondary use when pandemic conditions recede, such as a pandemic response and testing facility transitioning to a more general LMI community health center? So projects should have a plan if the project is directly addressing the pandemic. A testing site could be a health center, a homeless shelter could become supportive housing, things like that. So what were you going to say, Ted? I apologize.
Say, like if they were, funding improvements to a housing a shelter or something like that for the homeless, sure, it's already eligible, and it would continue to be eligible. So if you're going to be doing construction to a facility, you need to, when you're submitting your pre-application, a description of how the use is going to continue after the fact, after this COVID crisis is resolved, and that its continued use will be use consistent with Cdbg program requirements.
Okay. I see a question that says, basically a comment, we need the 4-factor analysis process now in order to know if we have to publish public hearing notices in Spanish. We do have that available. So if you email us at cdbg@deo.myflorida.com, we can provide that to you. And that will also be in our pre-application and should be linked within our program guidelines. And that will all be online before February 1st when the pre-application cycle opens. Is an EOC a project covered under Cdbg Cv funds?
I don't believe an EOC is included under the, I mean, you're talking about local government agencies. I know for a regular disaster recovery program, an EOC, which was impacted by the disaster, could be rehabbed and such. So on one hand, it may be eligible. We'll have to put that down in up for discussion. Right. But if you're doing it, funding anything, that the activities that you're funding would have to be directly related to, COVID. Like maybe putting in an improved HVAC air purification system, maybe rehabbing the facility to allow people to continue to provide services. With proper social distancing and such. Generally speaking, it sounds like a good project to me, but I'd still like to discuss it and then put the answer in writing. Sounds like it.
And I think it would be, your question about whether it has the tie related to COVID, I think would be a little bit of a challenge there. And typically also want to just remind folks that HUD is looking at these Cdbg Cv funds generally as being temporary solutions and things that not creating permanent projects and things like that, but like temporarily rehabilitate, purposing something so that you can have an opportunity to use it for social distancing or things like that, but not for things that are permanent types of structures or new construction. It says, can Cdbg Cv funds be used to rehabilitate a county jail for COVID safety? I think that would be kind of a similar question. It may have the tie to COVID, but does it have the, temporary nature that HUD is really looking for that?
My general perception of this is I strongly doubt it. That's we've never ever used funds for any disaster in my history in the program for a jail. Law enforcement facilities are generally considered unallowable.
Right. And there's a question about the 4-factor analysis and how to do that. We will provide that information on our website before the pre-application opens. It says, is there a required amount of days the public notice ad should run in the newspaper? Does the ad need to also be in Spanish and Haitian Creole?
My answer is the general response. They have to be published at least 5 days prior to the public hearing. And so that would mean you count the day of publication, you go 5 days, and then the day after that is when you can hold the public hearing. And pose the rest of that question to me again, I'm sorry.
The question about does the ad need to be in Spanish and Haitian Creole? I think they would have to go through the 4-factor analysis in order to determine if it would need to be done in their community.
Okay.
Okay.
I mean, if they've done the applications in the past, then they may already know whether that is needed. It's like in southern Florida, like Miami-Dade County, they published in both Hispanic and Creole and such, because they know they have those populations. If you do know you have a significant population identified, then it would certainly be an allowable cost. If it turned out that you didn't need it because you didn't have that population, that it's not that it would necessarily be an unallowable cost. It just not necessarily that ineffective or efficient use of the funds.
Okay. Would a workforce training center run by the county and the college be eligible presumed LMI if it focuses on the unemployed and retraining to get back in the workforce? And again, I do think that generally training would be something that would be an eligible activity.
Again, that's something that I'd like to discuss with Kathleen.
Okay. Is an air handling system replacement of a publicly owned and operated long-term residence and rehab center eligible?
It could be. I would think a long-term care facility. You're talking about somebody's been treated in the hospital and they're like on the rehab, or is it and it's publicly owned? It might be it. That's how do you determine, whether it needs, is that, I don't necessarily, a long-term care facility is considered presumed LMI. If you were serving only, like elderly or something in there, well, then I think you could probably make that presumption. But again, that's something that we'll have to discuss with Kathleen.
Right. And I think they would also need to make sure that they show the COVID tie related to the air handling system and that there's a reason for
that's presumed for any project that they come down, whether that's your primary consideration. Then you'd be looking at how do you document under the LMI national objective that this is a necessary project.
Okay. Can we use funding for grant administration staff time outside grant consultant?
You can. It's always allowable under a Cdbg program to use either, your force account labor, which would be your administrative staff, and direct charge their time to the grant for those hours that they spend on the project, as well as you can procure professional services to assist you. I think as part of our pre-application review process, we're looking for those communities that don't have the staffing or experience, to manage a grant on their own, that they, acknowledge that and they've undertaken an effort to procure those professional services. So simple answer is yes, you can. If you're charging your staff's time to it for each pay period that they spend time that you are going to either charge back to the grant for application preparation or for application or for project administration, you have to account for the hours direct charge to the project and all other hours worked. And then those costs can be charged back to the grant, but you have to undertake it now and maintain it going forward. You can't come back later and decide you want to track your time or costs. You need to start tracking those now.
Okay. And for the purposes of the total that they can ask for, it would be 8% of the project cost up to a maximum of $50,000. That will be updated in our program guidelines.
That's for, I'm sorry, go ahead, never mind.
That's for administration costs.
Yes, ma'am. Mm-hmm.
Okay. It also talks about duplication of benefits procedures, and that's not in our guidelines. We will be providing additional information on DOB procedures and can provide those examples to you. It will depend on the type of project that you are undertaking as to what type of procedure you would need to put into place. Another question is, would refurbishing a city community center the building is old and needs upgrades for ADA in an LMI area for testing and vaccine distribution qualify. And then Kathleen has answered this, that it could be eligible if it's serving an LMI community. You would need to make sure that you have a community that meets the LMI objective.
That's correct.
Would enhancements of a food bank within a qualifying city which serves within this city and also has a much further reaching distribution area qualify? And they're asking if this could be met under urgent need.
Technically, you could apply for a project like that under urgent need, but you'd have to, again, as Kate was saying, tied directly to the impact of COVID and the improvements you're making allow the facility to continue to serve people effectively during the COVID crisis.
Right. And Kathleen has also added some information. We would need some more information on the service area that was included here.
Yeah. I would presume when they're talking about the service area that it does not serve outside the jurisdiction of the recipient. If the city is running something, within its corporate boundaries and such, it's not also providing services, out in the county, unless the county is also a small city Cdbg eligible party, and they are, coordinating with the local government, are willing to enter into an interlocal agreement, or maybe jointly applying for such a project. Again, these, I would just try to keep this answer here general, and if you have more specific questions, shoot them into the mailbox there, and we'll try and consult with you to get more information and give you a more informative answer.
Right. And I think some of these questions that we've been going through, I just want to remind everyone, as we saw from our consultant who had indicated this here, is that a lot of times these examples don't give us enough information to make sure that they're doing all three things. One, that they're an eligible activity. Two, that they meet a national objective, and three, that they're related to COVID. So you have to meet all three of those objectives in order to be eligible for Cdbg Cv funds. So do keep that in mind, that some of these questions, when we're answering them, we don't quite have enough information to give the full answer, and it would be helpful to kind of really have an opportunity to give you that technical assistance over the phone and get more information about your program, so that we can do that. So you can set up a technical assistance if you send it to the Cdbg-Cv at deo.myflorida.com, and we will have someone reach out to you and provide you with technical assistance. It says, can the Cdbg Cv funds be used to provide public outreach and education on COVID to LMI areas? Yes, this very possibly could be an eligible activity under a public service activity, but want to make sure again that this area would be LMI.
I would agree.
It also appears like Kathleen is helping us with the answer to, for limited clientele LMI projects, what level of income verification does FDEO want? An income survey or more? And I believe she's going to be kind of putting some information into the chat for you on that.
Are you looking for a response from me?
I think that, didn't you already sort of go over this a little bit, that it would similar to your housing income
It would be
verification?
similar to the housing. If they're talking about outreach and stuff like that on an area basis, they could use a survey, if they're just targeting like a neighborhood or something like that. But if they're, providing direct services to individuals, they'd probably want to do some sort of income verification.
Right.
I'd have to get in.
Kathleen has given a response here that talks about how one way that you could kind of easily do that is if you targeted a presumed LMI beneficiary group, such as seniors or homeless groups, and that was you limited your clientele to that. That's one way that you could do the documentation. Or two, you could have income documentation documents like self-certifications. Three, some sort of documentations that the beneficiaries are qualified by some other source. An example of this would be residents of Section 8 housing or Medicaid recipients. Okay, well, I think that we've gone through all of our questions. I'm going to pass it over to, I think that if you have additional questions, we're going to be providing more documents in the coming days. We'll be updating our program guidelines, updating our FAQs, and getting the Cdbg Cv pre-application registration online and available to you by February 1st. So please recheck the website on February 1st. We'll be providing you with those slides and things like that. So I am going to change the slide and pass it back over to Sharita to close out the webinar.
Okay. Once again, we thank you for participating in our webinar today. As we mentioned, the webinar slide will be provided on the Cdbg Cv website. We also will have the updated FAQ and all other Cdbg Cv source materials as they become available. If you have questions, please don't hesitate to reach out to the Cdbg program staff at the number and email
Sorry.
Thank you again, and we hope you enjoy the rest of your day.
Okay, thank you guys, and apologize for messing up the slides there at the end. Thanks, everyone.